Hello, my name is Sami. I would like to thank the editorial board of the Aesthetic Surgery Journal for choosing our article for an editor's choice video accompanying the article's upcoming publication in the November issue of the journal. The title of the article is Venous Thromboembolism and Bleeding Events with Chemoprophylaxis in Abdominoplasty, Systematic Review and Pooled Analysis of 1,596 patients. Abdominoplasty is a popular aesthetic body contour surgery that's associated with one of the highest rates of VTE events amongst plastic surgery procedures. Patient safety remains one of the primary concerns of the aesthetic surgeon, so if VTE prophylaxis offers us the ability to reduce our patients' risk, it still remains underutilized. Some recent survey of board-certified plastic surgeons revealed that nearly half used no VTE chemoprophylaxis in their body contouring surgeries, and the number one cited reason for this avoidance was the risk of postoperative bleeding events. A total of 544 articles were screened, and ultimately, after applying exclusion criteria, 10 articles remain with a total of 1,596 patients for the pooled analysis. Takeaways for the study are: number one, VTE chemoprophylaxis in patients undergoing abdominoplasty with or without liposuction is safe, with a pooled incidence of bleeding events of 1.6%, and chemoprophylaxis did not increase the risk of bleeding events. Number two, interestingly, preoperative chemoprophylaxis was found to increase the likelihood of bleeding, but postoperative chemoprophylaxis was not associated with increased bleeding events. And number three, the benefit of routine chemoprophylaxis for VTE reduction on non-risk stratified patients remains unclear based on the current literature. Overall VTE incidence in this study was low at 0.56%, consistent with the previous literature. The administration of VTE chemoprophylaxis did not reduce the incidence of VTE events, but this finding is hard to interpret as most studies fail to adequately risk stratify patients, so we cannot comment on the benefits in high-risk versus low-risk patients. And also, because of the low incidence VTE events, the study is underpowered to adequately statistically evaluate the potential benefit in certain high-risk populations. So what does all this mean? This is the first systematic review to evaluate the risk of bleeding events in patients undergoing abdominoplasty receiving VTE chemoprophylaxis, and we showed that from a bleeding standpoint, VTE chemoprophylaxis is safe. This systematic review may be underpowered, but this reflects the relative dearth of studies with good outcomes reporting to allow for inclusion in a systematic review.